Hi, I'm Dr. Mike Saag at UAB.
Hi, I'm Dr. David Thrasher, Montgomery, Alabama.
So we're here to talk to you today about vaccines. Dr. Thrasher, what are you seeing in Montgomery?
Well, it's getting better here for sure. Fortunately, over over 90% of doctors in Alabama and nationwide have been vaccinated, and that's been a really great help. Most of the people over 65 nationwide have been vaccinated. Unfortunately, the people younger than 65 are not getting vaccinated as much as we need to. This pandemic's not over, Mike. Over the last 2 weeks, we've seen more people contract COVID-19 than they did in the first 6 months of the pandemic. And unfortunately, nationwide demographics are changed for hospitalized patients. Now the average age is less than 50 years old for people who are being admitted to the hospital, not to mention the problem we're having with long haulers and young people. What are you seeing, Mike?
Well, so the exact same thing, Dave. And what I'm hearing from younger people is that there's concern about the safety of the vaccine. What I'd like to suggest is what we should think about is it's not a question of get the vaccine versus not get the vaccine. It's a question of get the vaccine or run the risk of getting COVID. And for me, we know a lot about the safety. These vaccines are as safe as any vaccine that we give, even safer than the influenza vaccine, which most of us take every year. So here's my take. Getting vaccinated is our ticket to freedom. It's our exit ramp off this pandemic highway, and it gets us back to life as we want it, life as we want to live it. And the sooner we can get to that, the better. Congregate with friends, go out to restaurants, go to movie theaters, and go to sporting events, and let's get back to normal. If we all do this together, we can be back to normal by this summer. What do you think, Dave?
You're so right, Mike. That's exactly right. I really enjoy going out to restaurants with people who are vaccinated, like myself and my family. And we're going to get to a herd immunity. We can get there the easy way with vaccines, or unfortunately the hard way with more people getting sick and dying. I want the easy route. I'm tired of this mess.
Me too. And I'll just say all of my family has been vaccinated now, including my kids who are in their late 20s, early 30s, including my daughter, who at 16 weeks of pregnancy talked to me about it. She got vaccinated, did very well. What we didn't want to see is her get COVID in the third trimester of pregnancy. That would be a very difficult thing. And I know you see that as a lung doctor there in Montgomery, that when people in pregnancy come in with a viral illness.
Yeah, you're certainly right, Mike. We have treated quite a few pregnant women that had COVID, and we know if you're pregnant and you get COVID, you have a tremendous more of a chance to getting admitted to the ICU than if you don't. We just fortunately had a lady that we just got off the ventilator, and she's going to do well, but we were not sure she was going to live, and she was pregnant. The baby did well as well.
So why don't we all pull together? The doctors are doing it. Most of all of us have been vaccinated, the staffs at the hospital. We do that because we know that the vaccines work, and more importantly, that these vaccines are safe. And if we all do this together, it'll be good for us. It'll be good for our family. It'll be good for our community. So let's get it done.
Let's get it done is right. Thank you, Mike.
Thank you, Dave.